Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll focus on electrode setup for pain modulation and examine how placement and spacing affect the treatment area, patient comfort, and overall effectiveness. Let's start with the electrode and treatment size. The electrode number is based on the size of the treatment area. For smaller localized pain, we typically use 2 electrodes in a bipolar setup. For larger or more diffuse pain, we use 4 electrodes in a quadrupolar setup. Here's a key point. Quadrupolar setups can be arranged in different ways. In the top image, the electrodes are placed in a crisscross or X pattern. In the bottom image, the electrodes are arranged in parallel. With interferential current, a crisscross setup is required because the currents intersect within the tissue. However, when using pulsed or premodulated current, you can create a quadrupolar setup with 2 channels using either pattern. Electrode size also affects how the stimulation is delivered. Smaller electrodes allow for more precise targeting of a specific area. However, they increase current density, which may reduce comfort. Larger electrodes are less precise, but they spread the current over a greater area. This lowers current density and is often more comfortable for the patient. In the image, you can see a comparison between a 2 by 2 centimeter electrode and a 5 by 5 centimeter electrode. If the same current is applied, the smaller electrode has a higher current density because the area is smaller. Current density is calculated as current divided by electrode area. So as electrode size decreases, current density increases. And as electrode size increases, current density decreases. Okay, let's look at electrode placement. There are 2 common approaches to electrode placement for pain modulation. The first is bracketing the pain, where the pain is positioned between the electrodes. This is typically used for joint pain, diffuse symptoms, or larger treatment areas. The second approach targets the pain, placing the electrode directly over the painful area. This is more appropriate for trigger points or localized pain. Choosing between these approaches depends on the size and location of the patient's symptoms. Another key issue is spacing, or the distance between electrodes, which also affects how the stimulation is perceived. A typical guideline is about 1 to 2 electrode widths between electrodes. When electrodes are placed closer together, the stimulation is felt more superficially and may feel more intense. When electrodes are placed farther apart, the stimulation is felt deeper and covers a broader area. Now let's look at placement and spacing together. In both of these examples, the goal is to bracket the pain, meaning the painful area is positioned between the electrodes. For high rate or sensory TENS, the electrodes are placed closer together. This creates a more superficial current and preferentially stimulates sensory nerves. For low rate or acupuncture-like TENS, the electrodes are placed farther apart. In this case, the electrodes are also positioned over the muscle to increase the depth of current and recruit motor units. So even though both setups bracket the pain, the spacing and placement change based on whether we want a sensory or motor response. If you want a deeper review of high rate and low rate TENS, I cover that in a separate micro lesson. Polarity is a common concern when using electrical stimulation, but it is less relevant with certain waveforms. With alternating current, such as interferential or premodulated, polarity is not a concern because the current alternates direction continuously, resulting in no net charge buildup in the tissue. Similarly, symmetrical biphasic pulse current is charge balanced. Because the phases are equal and opposite, there is no net accumulation of charge. As a result, when using these currents for pain modulation, electrode polarity need not be considered during setup. To wrap up, let's look at another key concept in electrotherapy: accommodation. Accommodation occurs when nerves adapt to a constant electrical stimulus, especially when the settings remain unchanged. Over time, this adaptation leads to a reduced response, resulting in a reduced treatment effect during electrotherapy. This is why we often adjust or modulate the settings to maintain effectiveness throughout the treatment. Now, let's look at options for addressing accommodation. One option is to manually increase the intensity amplitude during treatment. For pulse current, many devices use a modulation setting that gradually decreases and then returns the intensity to its original level. With alternating current, a frequency scan, often called a sweep, is used to vary the stimulus and help reduce accommodation.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.